we battle the pandemic, while we try to protect people, let us not just protect them from the pandemic, but also make sure that what was coming as a consequence of our corrective actions or our restrictions did not indeed wipe out some of the gains that you were going to make from the pandemic control. And these included not just in the economic domain or in monetary terms, but well into how it impacted public health, access to health, prevention, our programs, and so forth. So this was the total backdrop. Now, specific actions within it were very crucial. We all talked about a whole of the government response, about everybody coming together, coherence, coordination, the NCOC, all that is good. But I think it was targeted not just for coherence of action, but for actions that actually had impacts that transcended social boundaries, social barriers, geography, and style of living, etc. So this coherence was first and foremost. The second bit, I think, that defined our response for the pandemic was the fact that, for once, our decisions at a government level were driven by direct statistical facts, by epidemic responses. So all around the globe, we saw that there was, at times in advanced developed countries, we saw some incoherence and some disagreements and difficulties. But at least in Pakistan, we were able to cobble together a coherent response that was data-driven, based on information, based on scientific information, which was not just nuanced, but also flexible and responsive. So I think that was the second bit that was crucially important. The third part was the ability to not just coordinate detection or disease or analysis and throwing out recommendations, but the ability to actually reach out to provincial entities despite an 18th Amendment scenario, to be able to have a coherent preparation for the pandemic and what was to come and so forth. And the next bit was even more important, which was to enable longevity to this process. It is quite okay to be able to build a response or to cobble together a response in real time, but to be able to ensure that it actually sustains, not only during the present cycles and waves of the pandemic, but to be able to be prepared for future threats and future risks that come along. So in line with that, the government's healthcare reform agenda is solidly along the lines of what is the usual playbook for this. So first and foremost, the access to care. And one of the things that, and so looking beyond a little bit the epidemic part of it, but to actually general health in perspective. So what destroys a lot of households and trips them over into poverty, into becoming recipients for SRs and such initiatives, very often is catastrophic health expenses. And so this whole Sehat card idea, nothing new, but the implementation, and it's across the board implementation, and as it's growing, is crucial as one of the pillars. So access to care. There are other bits to it, but we perhaps, if there is interest, we'll talk about it. The second important bit out of all this has been to ensure that the HR, the manpower that is created and generated to take care of those that require help and health is of sufficient numbers and of sufficient quality. So therefore, the reform of the regulating entities within Pakistan, the Pakistan Medical Commission, the Pakistan Nursing Council, and other such regulators is not only on the cards, is already partially underway. The next bit is crucial and important, both in the pandemic perspective as well as long term, is our ability to generate, regulate, create, innovate medical devices and medications and vaccines. So I think the reform of the current regulatory environment for the Drug Regulatory Authority of Pakistan and similar is on the cards, and you will see more of it soon. And while this is not an exhaustive list, but I do feel that of the delivery of healthcare is one more aspect and tenet that we need to keep focus on, and that is governance and institutional reform. Many of our institutions, whether large or small, whether serving the primary care network or large tertiary hospitals, despite receiving funds, are often poorly managed. And I think a reform of how these are governed has been crucial. So the next pillar in the reform agenda has been of reforming not only the major teaching institutions. You've heard about the MPI Act, both within the federal territories and others, but also of the primary and secondary healthcare networks. So this is also a work that is in partial process. So we hope that what's been highlighted to us because of the pandemic is not just restricted to the pandemic itself. There is a pandemic response, but it needs to build some sustainability so that we have a healthcare system that truly takes care of the weakest parts of society. So I'll stop here.
Thank you so much, Dr. Sultan. That was very comprehensive. And there are a couple of points that I'd like to come back to you on as well. And I think they're interlinked. So for instance, if we talk about access to healthcare, universal healthcare, or universal basic income, those are tied together. But I'm going to move on to Mr. Aslam now, and because this is also linked. Food security is linked to climate change, disasters that keep on happening, disrupt systems and displace people and impact the most marginalized, and that's also linked as well. We know that climate change is an existential challenge, not just in Pakistan, which is a very country that's extremely vulnerable, but around the world as well. Could you talk about your initiatives? We know that the pre-foundation program on a massive scale has also gotten recognition globally. But what else? What is